Perfect. And it is 11:05. I anticipate that we will continue to have people scroll in as we had a large registration. But until then, we will get started with this session. I would like to start off by telling everybody, good welcome and welcome to this session where we will be focusing on hydroxyurea use in sickle cell disease and what you need to know. We have three amazing panelists here today with us. But before then, let me introduce myself. My name is Samah Yahya, and I'm the education coordinator for SCAGO. I use my preferred pronouns are she, her, and I'm really excited to moderate this session. So if anyone, just to start off, would like to refer back to this session afterwards, we do post this on our website later, and I will put the link in the chat right now. And you can view it whenever you want at your convenience. So here it is. Let's see if that works. And that's our website for sickle cell anemia. So one of our missions at SCAGO is to serve as a conduit for members to access evidence-based information, as well as hearing from experts on different topics pertaining to sickle cell disease. And that's why we have three amazing guests here today. Today's session is incredibly important because hydroxyurea is an important medication used in sickle cell disease that is very effective, but also a lot of people don't know about. So having some people here to share their perspectives as well as some of the science behind it is going to be really, really educational and informative for everyone here. And hopefully you can take that knowledge and share it with people you know as well. So to start off, we have three panelists, and I will be introducing them now. We'll start off with Dr. Robert Klaassen, if you can just wave. So Dr. Robert Klaassen is a pediatric hematologist/oncologist and the program leader of the hematology program at the Children's Hospital of Eastern Ontario, as well as a full professor at the University of Ottawa. He's always been a strong advocate for patients with hemoglobinopathies. He's a founding member of the Canadian Hemoglobinopathies Association, otherwise known as CAM-HEM, and he has successfully co-chaired 3 conferences focusing on hemoglobinopathies, including the first National Canadian Sickle Cell Conference. In 2005, he actively lobbied the Ontario government to include hemoglobinopathies in the expansion of the newborn screening program. He's also the lead owner / inventor of the quality of life measurement tool for thalassemia called TranQOL, or TranQOL maybe, which has been used in numerous multi-center clinical drug trials for patients with thalassemia. So welcome, Dr. Klaassen, and thank you for coming today. We also have Tanya Else here as well. You want to wave, Tanya? Perfect. Tanya Else is married and the mother of 2 girls and a boy, and she is a sickle cell carrier, and her son has sickle cell anemia, SS. Her professional background is in human resources, so she is currently working at the Library of Parliament as an HR systems analyst. She holds a bachelor's degree in business administration from the Université de Québec at Montréal. Hopefully I got that. And she is completing her graduate studies in project management at the Université de Québec UQO, or UQO. Her hobby is knitting and crocheting, which she uses as a channel to provide Black girls and boys with dolls that reflect their image. Tanya supports SCAGO as the bilingual English-French support person, the Patient Advocacy and Awareness Council, and the Southeastern Ontario coordinator covering Ottawa and regions around. She's also a co-coordinator for the SCAGO Peer Support Group. So thank you again and welcome, Tanya. And finally, but not last, we have Brittany. So Brittany Lacheee, she is an arts and entertainment publicist with an extensive background in event planning across Canada. She got her start in corporate marketing roles working for companies like Jameson Vitamins and Kia Canada. In her spare time, she runs events and PR agencies where she works, where her work prioritizes around undeserved NPOs, performing artists, entrepreneurs, and much more. As a young As a young Black owner of a boutique agency, she has faced much adversity, especially as a woman living with sickle cell anemia. Brittany has faced many employment struggles in her events and marketing industry, hence her desire to create opportunities for herself and other BIPOC women. Okay, perfect. So thank you all. I would just like to put it again. So Brittany, can you give us another wave before we start? I don't think I've asked you before. So we're going to quickly start with something really important, which is our land acknowledgement and some other housekeeping rules, which then will be followed by presentations from our guest speakers and a Q&A session. So everybody here can ask questions that they want to know and they want to learn more about. We do ask that you kindly save those questions, thoughts, or concerns until the later portion of the session, where your guests will be able to answer them individually. We do have the chat function for this as well. So first, let's kindly talk about some housekeeping rules. We kindly ask that you respect this learning space by aiding in these specific rules. So one, which is great as a webinar, you don't have your microphones, but please be cautious of what you write in the chats to make sure that we're not impeding on any concentration or talking or any discussion that's happening. We have closed captioning that is provided. We ask that everyone, when asking questions, to use respectful language, so no profanity or inappropriate images, posts, etc. Please do not post any other material unrelated to today's discussion topic, and keep discussions and comments on this topic as much as possible. SCAGO does reserve the right to pause the session or seek removal of participants who do not abide by these rules. And we thank you, though, for understanding and your agreement to this positive participation as well as this learning space. And just one more disclaimer before we jump to our land acknowledgement. Remember that the information today does not constitute medical advice and is shared with you for information purposes only. No materials shared with you are intended to substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you have regarding a medical option or treatment before undertaking a new healthcare regimen. Please do not disregard professional medical advice or delay seeking it because of something said at this webinar. Okay, perfect. So as our land acknowledgement, I would like to begin by acknowledging the Indigenous peoples of all the lands that we are on today. While we meet today on a virtual platform, I would like to take a moment to acknowledge the importance of the land which we call home. We do this to reaffirm our commitment and responsibility in improving relationships and nations and improving our own understanding of local Indigenous peoples and their cultures. From coast to coast, we acknowledge the ancestral and unceded territory of the Inuit, Métis, and First Nations peoples that call these lands home. So we know that for me in Toronto, we are on the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, as well as the Wendat people, as well as many other diverse First Nations, Inuit, and Métis groups. And we acknowledge also that Toronto is covered by the Treaty 13 of the Mississaugas of the Credit. So without further ado, good morning, speakers, and thank you for joining us today. I'll pass it to Dr. Klaassen.
Hi, thank you so much. That was a lot of work. I was very impressed with your introduction. That's great. And I'm very impressed with all the people who took time out from this beautiful sunny day to sit in front of their computer. Hopefully you're doing it outside in the sunshine and you can actually see your computer screen. So I'm going to talk about hydroxyurea in use in sickle cell disease, which may seem like, oh, we've known about this medicine for a long time. Why are you talking about it? I think it's always good to I know with my patients in particular, if you have to take something every day all the time, after a while it gets a bit tedious and you're going, why am I actually taking this medicine? So I think it's really important to kind of understand why we're actually, why we recommend this medicine. And right now it's really the only approved treatment in Canada for sickle cell disease. There are other drugs out there, but right now this is kind of what we're left with. But fortunately, it's a good medicine. So I'll go into a bit more on that. Okay, and There we go. So I'm going to talk a little bit about what is sickle cell disease, just to remind people about sickle cell disease. And what about this thing called fetal hemoglobin? We're going to talk about it because it's actually quite important with hydroxyurea. Go more into that. And so I'm not going to talk about gene therapy. Sorry, I deleted that from the slide. Apologize. And then we'll do a conclusion. So sickle cell disease, as everybody knows, are red blood cells, which makes up, so if you look at your blood, about a third of your blood is these red blood cells. And they look like donuts, but the hole doesn't go all the way through. So the donuts, and sickle cell disease is when the donuts change into these sickled cells. That's the name. So getting into more detail, which is maybe a bit more than you want, but inside the red blood cells, they're big bags full of things called hemoglobin. And hemoglobin's main job is oxygen carrying. And they have these things called heme. So there's a globin and there's a heme group. So there's 4 heme groups inside. And each one of those grabs onto a molecule of oxygen. So each hemoglobin carries 4 molecules of oxygen. And so you breathe in, oxygen goes into the red blood cells, sticks onto this heme, travels down to your toe or your brain or whatever, and then it releases the oxygen, so it gets to where you want it to be. What happens in sickle cell disease is there's a change in that globin chain, and it makes it sticky. So when I'm showing you this is basically, this grouping here is one of these balls right here, and they stick together. What happens is they stick together in these pairs. You can see they stick in pairs, and then they form in a very specific pattern, 7 pairs in each line, and what's called polymerizes, sticks together and forms these long sticks. So the hemoglobin, rather than floating around nicely, sticks together and makes these long sticks inside the red blood cells. And that in turn changes them from these. So here you have the normal cell, which is it's all free floating hemoglobin. It forms these long sticks, and that's what distorts the red cell shape. Hopefully that makes sense. And this is just kind of a big picture of what it is that you have 2 main problems in sickle cell disease. So I think we often think about the problem of it blocking up the blood vessels. So there's funny shaped cells. So the donuts are very flexible. They can worm their way through anything. So you have a very small blood vessels. The red blood cells can very easily get through them. When they're sickled cells, they become rigid and they block up and that's what causes the blockage of blood flow. So you're actually blocking blood flow to a part of the body, and so it doesn't get the oxygen it needs and it dies. So you're actually killing little parts. Sickle cell disease can actually kill off small parts of the body. So that's one problem. It's called the vaso-occlusion. Occlusion being blockage of the blood vessels. That's what vaso-occlusion means. And then the other thing is the red blood cell breaking down. It's called hemolysis. So the cells are more fragile. They break apart when they're like this, and you release. And mainly we'll talk about bilirubin, which is the thing that makes you yellow. So if patients, especially the white parts of your eyes, turn yellow, that's because of the red blood cells breaking apart and making the red blood cells. And so these 2 problems cause the main issues. So there's pain crises, and we're going to call it chest syndrome and bone necrosis. But it also, the one with the red blood cell breakdown causes things like leg ulcers, stroke and other issues to that effect. So what happens in newborn babies have this thing called fetal hemoglobin. And the good news is fetal hemoglobin doesn't have the sickle change in it. So it's actually, so when you're a newborn, you can see that if you kind of look across, the hemoglobin F is the pink here, and you look across, you're born with about over 80% or 85% of your blood being this fetal hemoglobin. It doesn't have the sickle in it. So the sickle change in it. So newborn babies do not have any trouble. Unfortunately, for whatever reason, I mean, the body is designed so that over the next few months, it changes from fetal hemoglobin to what's called adult hemoglobin, where the problem is. And so you can see this is actually blood work from a baby, you can see from 2021 that I follow. And the fetal hemoglobin, which started at 80%, very quickly drops down to 40%, 50%. You can see within a few months after the baby being born. And the same point, this blue line is the sickle hemoglobin. So the sickle hemoglobin goes up. So the F goes down, the sickle hemoglobin goes up. And then what we routinely do in my clinic is at 9 months of age, we start we start hydroxyurea medicine. And you can see what happens. So the S was steadily going up, the F was steadily going down. We started the hydroxyurea and we kind of in a reverse course. So you can see that the S started going down and the F started going back up. So we started that. Last time I gave this presentation, somebody said, well, why don't we start this earlier? And that's a very good question. And, you know, would it maybe have an impact? Unfortunately, that hasn't been studied. And I think because newborn babies are in a very crucial time in growth, it was feeling that and you don't tend to get the complications of sickle cell disease in general in the first few months, thought was to delay starting till later. But I think it's a very reasonable question. So hydroxyurea has been around for more than 100 years, like 1869. This is a very, very old drug. So we know it very well. And so there's the good and the bad of it. Because it's an old drug, it's cheap. It doesn't cost, it's not very expensive. The bad part about it is, you know, the good and the bad part of it is no drug companies are interested in this because they can't make a lot of money. So this is one of the reasons why studies in sickle cell disease with this drug were harder to do, because there wasn't a drug company funding behind it. So when we go and talk to you about hydroxyurea, nobody is making any money off of this. So you can rest assured that this is not some drug company, you know, on my doorstep, you know, taking me out to dinners for this drug, because they don't make any money off of this. And the key thing this does is this, as I showed you, the last thing is it stimulates, for whatever reason, we don't totally understand why, it stimulates the body to make this fetal hemoglobin. So this is just a blood smear. And remember I showed you, so this is, the first one is without the hydroxyurea. So you can see the sickled cells. You can see those sickled cells. They're very easy to see. So this is what it looked like before starting hydroxyurea. After starting hydroxyurea at a lower dose, there's still a few sickled cells, but it's definitely improved. And then when you get what's called the maximum tolerated dose, we work up to a dose that doesn't cause too many side effects. And as you can see that the sickled cells are virtually gone. So you can actually see this when you look through the microscope. In the good old days, we actually had microscopes in the clinic and we could show people. Now, unfortunately, it's back in the lab, so I can't actually show patients. So hydroxyurea. So of course, there's always potential concerns about side effects of hydroxyurea. One of the good and bad things about it is that it lowers white blood counts. The white cells are involved in infection. In sickle cell disease in patients who are not on hydroxyurea, the white cell count is actually artificially up. It's higher than normal, partly because there's a lot of inflammation going around because of this damage that's being done. The white cells kind of get stimulated and they're high up, they're increased. So some lowering and bringing it down to the normal range is actually a good thing. But if you bring it down too low, there's a potential risk of infection. Platelets are small cells that float around in your body, and their job is to stop you from bleeding. So if you cut yourself, the first thing that stops the bleeding is the platelets. So hydroxyurea, one of the potential bad problems is the platelet count can go too low. So because of this, the annoying part of being on this medicine is we do need to do blood work more often than usual. So I freely admit that that's a problem. Once you get on a stable dose and things are good, you can do blood work. We do every 2 to 3 months. So it's not so bad. At the beginning, you have to do it about every 2 weeks. But once you're on a stable dose, you can do it every 3 months. And this is why we're doing that blood work. It's not just I feel bad with some patients, you know, oh, more blood tests. But it's actually for a reason, because we want to make sure that this white cell count doesn't go too low and the platelets don't go too low. There's potential side effects of nausea, vomiting, and diarrhea. I got to admit, I haven't seen that very much, and usually it's a temporary problem at the beginning and it goes away. Other things, you can get problems with the liver tests. Again, usually that's a problem that's very temporary, it goes away. Skin rash is very interesting. So you can get these nail changes. So you get these lines in your nails and darkness around the nails as well. So I kind of warn people about this because they, what's going on, but we've seen that. Fortunately, it's just a cosmetic thing. It's not dangerous. And, you know, darkening of the skin and the nails, and occasionally lack of appetite. I've had some girls lose thinning out of their hair when they initially start, but that settles down. So I know some parents have come to me and their kids have lost some hair, but it does settle down and it sort of stabilizes. But again, the loss of appetite is not a long-term problem. Again, follow in our clinic, we follow more than 200 children with sickle cell disease, and over 150 of them are on hydroxyurea, and it's quite well tolerated amongst that group. We have not seen any trouble. Actually, one thing I just want to mention, because those of you, you know, there used to be a concern about it potentially causing cancer, was one of the questions, and there's also a question about it impacting on fertility. The good news is there's been lots of really good studies that show that there's no increased incidence of cancer on hydroxyurea versus off of hydroxyurea. Unfortunately, having sickle cell disease itself does increase your risk of having cancer, only slightly, not a big risk. So I think it's something to keep in mind. So I think some of the issues, people didn't realize this, that you have a slightly increased risk of cancer, usually blood kind of cancers in sickle cell disease. It's, again, overall still very rare. So I don't want people to panic about that, but it's still very rare. But that's why some of the flags came up in the past about the potential of the hydroxyurea, but the good studies have not shown any increased risk of cancer. So that's the good news. And then fertility, again, there was this concern about fertility. We do know that the production of sperm for men goes down when they're on hydroxyurea. The good news is if you stop hydroxy, if you get to the age where you want to have children, you stop the hydroxyurea, your sperm count will come up. And again, there's an issue, sickle cell disease itself can affect sperm production. So I think but there's been many, many children born to both mothers and fathers on hydroxyurea, and there's been no evidence of what we call teratogenic, so effects on the fetus. But still, I think in general, we recommend that if you definitely want to have a child and you're planning on having a child, to hold the hydroxyurea during that time period. A little bit of a digression. So this was a study that was done of 122 children who were followed for about 4 years. And the side effects they did see was the lower white cell count. Again, it's manageable, but you do need to keep track of it. But there wasn't any kidney, liver, or growth problems. There was no cancer, no leukemia or other cancers. There was a little bit of skin changes, as we saw. During the study, there was 2 deaths. One was a transfusion, so totally unrelated to the hydroxyurea. There was 1 infection, but it did not correlate with a low white blood cell count. It felt to be due to the sickle cell disease. So the benefits, long-term studies show that the fetal hemoglobin, like I showed you, goes up. The overall hemoglobin goes up, so you have more energy, and the red blood cells get bigger, which is good. And then you get a decrease in the white blood cell count, and actually in the bilirubin. So you get less jaundice. So it actually helps with jaundice. So here's a study. This was done in babies. So this was called baby hugs. They have great names for these studies. But so this was done in babies who were randomized to getting hydroxycarbamide, is the British term for hydroxyurea. I don't know why the British always have to be different. But anyway, so that's the red line. And then the blue is placebo. And placebo is a sugar pill to look like hydroxyurea, but it doesn't actually have any impact. So this was and they showed chest crisis is where you have a occlusion in your lungs. It can be very dangerous. So on hydroxyurea, there's less over time. So these are weeks. So you can see there was less of these chest crises than placebo. Similarly, less pain, and this is a specific kind of problem. You get hand swelling, pain in the hands. There's definitely less hand swelling patients on hydroxyurea than those in the placebo, and less need for blood transfusions, which was good. And this study actually used a lower dose of hydroxyurea of what we recommend. So we think that the benefits are even better on the sort of what we call maximally tolerated dose of hydroxyurea. And one thing I didn't show is there was actually even less infections, because remember I was telling you the white blood cell came down, so people were worried they might have more infections, but there's actually less infections on the hydroxyurea than not. So that was very good news. here's a more recent study, again, of almost 2,000 children that you can see 267 were on hydroxyurea. The others weren't. This was back 10 years ago, so before we were routinely using hydroxyurea. Oh, my arrows kind of got lost. But anyways, there was a decreased mortality. So the important thing is there's actually less children who died from sickle cell disease on hydroxyurea than not on hydroxyurea. There was less infections, less chest crises, less hospitalizations, and less emergency department visits, and the hemoglobin went up. So this is a totally different population showing similar things that we're showing in the other population. And then this other study is more adult study. So you can see the age here is around 35. You can see, and what they did was they looked at patients not on hydroxyurea. So here is 130 patients. And sorry, and this is most of what I'm talking about is the SS kind. So the SS kind. So for those of you, unfortunately, who have I shouldn't say unfortunately, who have the SC kinds, there's less studies because they're less common, less SC and SD and other, they haven't been studied quite as well. So most of the studies I'm quoting are the SS kinds. So, but they seem to work equally well in the other populations. But you can see, so there's 130 patients who were not on hydroxyurea, again, average age of 30, 35, and patients who are on hydroxyurea, and they actually divided up into ones who were on good doses, higher doses versus lower doses. And you can see, I think the key thing that I want to show you is this line here is survival. So of the ones who were not on hydroxyurea and followed, 20% of them died over time. But the ones on any hydroxyurea, you can see that the risk of death was lower. And that's kind of the take-home message that I was saying, is that you can actually decrease your chance of dying being on it. And you can see and part of the reason is the fetal hemoglobin is higher. So we seem to think that that's really a key thing, is that you have this higher fetal hemoglobin, and that's what tends to protect you. And then, so the good news overall with sickle cell disease, especially in children, and I'm a pediatrician, so this is why I show a lot of pediatric data, but you can see that over time, so back in the 70s, this was the survival of patients with sickle cell disease. This is in Jamaica. You can see that by 2 years of age, 20% of children were dying sickle cell disease. So that's the way things were in the 70s, and then it improved. And this was with bringing in penicillin, using regular penicillin. This is the major improvement right here. And then you can see going into the 80s and into the 90s, you can see this is both London and Dallas, Texas. So you can see that the survival of children dramatically improved, and overall is very good. So here, 940 children followed by the Texas group, and you can see that up to 18 years of age, they almost have almost a normal lifespan. So huge improvements you can see that we've had over time. So some of this is penicillin, and others is the use of hydroxyurea. And the other thing is, this is overall looking at adults. This is published in 2010, so I think it's even better now. So this is data that's 13 years old. But you can see in the 1970s, there's all this group of children who were dying of sickle cell disease. And we know that happens in low-income countries in particular, where they're not getting proper treatment and not proper follow-up. There's still a lot of children dying of sickle cell disease. Fortunately, that does not happen in middle and high-income countries, and mainly because we prevent infections with penicillin. We use amoxicillin. So that was a big improvement. And then there's been some improvement. You can see that this shifted. So the median lifespan in this, median lifespan back in the 70s, late 70s, was around in the 20s to 30s. Then it shifted over to the 40s and the 50s. When this was published in 2010, I personally think with the regular use of hydroxyurea, this has shifted over even more, so that the median lifespan is more in the 50s and 60s. And as I get older, I appreciate, I'm in my 50s now, and I think we want to keep shifting that graph over because we want patients to have a normal lifespan, obviously. And I think the regular, because we've only been routinely using sickle cell disease as starting a young child in the last 10 to 15 years. So hopefully this whole thing is going to be shifting over. So again, sickle cell disease is an inherited disease of hemoglobin that causes the change in the shape of the red cells. The decrease in the fetal hemoglobin and the increase in sickle hemoglobin is when the complications start happening, and hydroxyurea is effective in increasing the fetal hemoglobin. Sorry, and I need to get rid of that part about gene therapy because I'm not talking about it this time. Sorry, this holdover from an old talk. I apologize. Hopefully you have maybe have some questions on that. I think so. It sounds like we're going to pause the questions till the end of all the speakers. Is that the plan?
Yes.
Okay, great. So I'll get rid of my question slide.
Okay, perfect. So thank you, Dr. Klaassen. I know I learned a lot about hydroxyurea from that as well. So next, I'm going to pass it to Brittany to give her perspective, and then we'll go to Tanya. Okay, I'll open it up.
Thank you. I definitely learned a lot myself. Of course, I have sickle cell and I'm on hydroxyurea, and I learned a lot. So thank you. A big part of the reason why I wanted to kind of get reintegrated into the sickle cell community is because I have SC. So as mentioned, there is not a lot of research or support around it. So I want to figure out how I can help through my lived experience. Living with sickle cell can be very challenging, as we all know, especially when you're faced with prolonged periods of illness or bed rest. It's difficult for the patient, family members, doctors. A lot of my doctors and nurses I grew up with, they're like my aunts and uncles. So it's like, it's not fun for anybody involved. So it's great to see that as time has gone on, we have other support, and it's not just all on us as a support group or community. With hydroxyurea as a treatment option, it's brought me a lot of hope. I can definitely say that, to ease symptoms of crises and just make life easier, and to have that support. So not to age myself, but I remember when I believe I was a part of a trial. Like, that's when I was first introduced to hydroxyurea. And I was like, I have sickle cell. I'm going to take Advil and morphine and go about my day. I couldn't process a cure or a treatment. So it's really incredible to be here like 10, 15 years later and seeing all of this data and improvement. And I hope that we can stay connected and continue that further. So having a temporary solution like hydroxyurea can give you the boost that you need to get back on your feet. The main thing in my experience with sickle cell is it's about the ups and downs and the ebbs and the flows of crises. So I could have great months, or I could miss 100 days of school in a school year. And it's a lifelong journey. So you have to, as a patient or a family member, accept that. And when life gets off track, hydroxyurea is a great backup to keep you moving forward with your health and your wellness and all of those things, and feeling strong. As mentioned earlier, I do own my own business. I am an entrepreneur. I work in events and marketing. I am a little crazy when it comes to my work life, and I got to find balance. But with that said, I just want to share my story, because when I was younger, I never would have thought I would be in an industry where I'm on my feet for 8 to 10 hours a day, lifting boxes, building stages, things like that. So hydroxyurea is the reason I was able to return to that crazy life that I love. Being an entrepreneur is very demanding. It demands so much of my time and my effort and dedication, time away from family and friends, all of these things. So hydroxyurea for me is not just about the bare minimum or being healthy or getting through. It's about living the life of my dreams. And that's what hydroxyurea is able to do for me and help me get through those struggles. Sickle cell can be very isolating, as you all know, and it can feel like there's no hope or no options. And I want people to just feel comfortable and feel open, because in my opinion and my experience, sickle cell is like, it's a 50-50 split for me. It's 50% mental, 50% physical. So how I approach situations, in my opinion, will impact my recovery. So when I was, to give you guys some more perspective, my childhood, I was in and out of the hospital frequently, maybe every other month, weeks and weeks at a time, lots of unanswered questions, unsure of what treatment I should consider, developing allergies to every medication I was on, like these types of things. I got to the point where I wasn't even able to have blood transfusions because I was going into rigors and all of these things. It got very, very crazy. But then I started taking hydroxyurea during the trial, and then I went maybe 15 years with 2 hospital visits. I didn't experience much nausea, any stomach issues, hair loss, things like that. I had to be more mindful of my sunscreen application, and that was pretty much it. So it was a good experience for me, but then I got healthy and I didn't need it anymore. And I became very focused on health and wellness and just trying to understand more and understand like preventative care better. So I started digging in and doing a lot of research and taking my vitamins and just being more diligent with my healthcare. And that kind of finished the process of getting out of this crisis cycle. So I was very happy. My skin was clearing up. I had great energy, all of these things. I was like, I don't need hydroxyurea. I'm good. I've been cured. And now I can just manage all of these health issues through diet and wellness and exercise and sleep. So I carried on like that, as I said, for about 15 years. I was hospitalized twice in that time. But during that time, I was, sorry, I just got a really random spam message. Sorry, that threw me off. But during that time, when I was hospitalized, I was never admitted. So I still didn't go my 2 or 3 week period in the hospital. But in hindsight, I can always look back and name a specific trigger. So was I not eating well? Was I not sleeping? Was I in a stressful situation? And so in that time, it was really like, I can take control. I can figure this out. And I started really focusing on a holistic lifestyle, and I thought I was good to go. And I thought I didn't need to rely so much on my doctors and hydroxyurea. Unfortunately, in 2020, November, I was in a car accident that I'm still recovering from. So I entered a phase when I was no longer in control, and I was frustrated, but I knew I had options. And I knew that I just needed to speak with my hematologist and get ahead of this like I had done other times. Before, I was very much against medication, wouldn't take an Advil, wouldn't take anything because of my childhood. So I've gone through so many different versions of patienthood, if that's a thing, where I'm either being pumped with meds or I refuse to take any. So when I came to this stage in my life, I was so much more comfortable with taking hydroxyurea. I wasn't scared. I wasn't worried. I knew that I have to ask my doctor the appropriate questions. I'll get my blood drawn and we'll figure it out, because at this stage, it's better than crisis every week. So I had gone through that long period of time where I was very healthy, but the crisis and the stress, the car accident and the stress and the physical therapy, the tough regimens that they were putting me through were triggering my crises like it was just one after the other, to the point where I wasn't able to walk. Even up until October of last year, I wasn't able to walk. So they got me back on hydroxyurea, and I'm very happy to say that since October to today, I haven't had one crisis. My energy has returned to normal. I am able to continue my physical therapy without worrying about the sickle cell, because these are 2 separate issues, but they are playing against each other. So I really want people to be aware that sometimes it's not just about sickle cell. You can have external stress or a separate infection or things like that, but you can speak to your doctor and understand how they are playing with each other. My understanding of hydroxyurea is that it's an inhibitor. So in my understanding, it keeps my sickle cell at bay while I am fighting through the physical therapy process. And I can focus on recovering from the actual physical injuries that I experienced. Let me see here. So I just wanted to say it's very important to understand that sickle cell and treatment is very, very different for everybody. What I mentioned earlier was that I have sickle cell SC. So my experience is different to those who have SS or SS and thalassemia combined, all of those things. But the importance is that we talk to each other and share our experiences and feel comfortable asking for support. I know that is very hard for me. Because of when I was learning about sickle cell, when I was at a young age, I didn't feel that I had the medical support. I had the love, but I didn't have the treatment. So it can be very easy to feel stuck in that. So I want to encourage you and your loved ones and your friends to ask the right questions, feel comfortable, and know that we are trying our best to improve the treatment and quality of life for sickle cell patients around the world. Thank you guys for your time.
Thank you so much. Sorry. Telling people learn more.
Sorry, there's an echo.
Oh. Okay, I think the echo's gone.
Yes.
Yeah. But just to reiterate, thank you so much for sharing your story and being vulnerable and coming today and talking about how you got through it. And yeah, that was very informative and very impactful. Thank you so much. And now I'll pass it to Tanya, who will give us the parent perspective. So Tanya, the floor is yours.
Thank you, Sama. Talking right after Dr. Klaassen that brought that scientific part, and Brittany, you did such a great job. So I think I can, I'll try to share as much as I can. On my side, Dr. Klaassen is the one who takes care of our lovely son, Elikia. He's following Elikia since he's born. So it's been now 11 going 12 years that we're working with Dr. Klaassen and Dr. Simpson at CHIO. So on our side, if I can start with a story saying that, Elikia had sickle cell. When we learned that, of course, you start with research, trying to understand more what it is about. And I think the reflex for every parent is, how can we cure that? We knew that there are not really a cure, apart from at the time was more the bone marrow. And what was funny with that is they will tell you is not sick enough to go through that cure, because there's risk for the one if they have to pull the person that I would be pulling it from, and also the patient that will be receiving that cure. So there was so many impact that you have to see a balance between, is the person so sick that we can take the risk to go through that cure? Then we're like, okay. And thanks God for Elikia, we did not had a lot, like any crisis until I think it was 5, when he started pre-K. So yes, we were admitted a lot because of the process. As soon as there's a fever, you have to go to the hospital. You have tons of tests that need to be run just to clear that there's no infection, there's no this, there's no that. So more often it will be at least 2 to 3 days in the hospital, and then it was like a cycle that we were learning to be in and going through. But from time to time, you just go, like when we will go to our regular meeting with the doctors, and we were like, okay, what can we do? Is there any new thing that is up there? And I remember regarding hydroxyurea, We were introduced to that very soon, I guess, but on our side, a little bit like Brittany said, you have that questioning. You like, is it really something that do we want? We know that it's a lifelong thing. Is it really what we want for our son? Is not another way that we can work around? And also reading, you had the side effects, all those things that was a little bit scaring us. And we were like, okay, do we really need it? We see that it can still function. We're trying as much as possible to I don't know if retain is the best word that I can use right now. And just a disclosure, I'm a French speaker first, so sometimes my English switched to French, but we were like, okay, maybe it's not the best moment, but yeah, there's the community. We were reading, I was part of some chats on Facebook, this type of places where they were talking about hydroxyurea as well. So we have what we were receiving from doctors and as well what we were receiving from other people that were taking it already. And I remember personally one thing that's really, that was one of the that encouraged me personally. I had an uncle, unfortunately, he passed away from sickle cell complication, but he was 50 when it happened. He was taking it, and he was one of the person that shared his experience, and we were like, okay, maybe it's something we can try with Alicia as well. And on his side, like I said, I believe Dr. Klaassen talked about that as well. We started first with the I've penicillin, but not amoxicillin. So the antibiotics that was giving prophylactic. So you learn all those words that you never knew before. So it's just that a little dose that is given on a daily basis, just to help to boost the body to fight against infections. So that was something already that was helping Alicia, and we were like, okay, fair enough. I think we can just like keep going like that. But at a certain point, he had a spleen enlargement, and that's one of the complications from sickle cell. So the spleen enlargement is really one thing that's weakened him a lot. He's starting having crisis, which he never had before. But I think the fact that at that moment we started hydroxyurea right before, like I believe, no, when the enlargement started, I think that's when the doctor started saying you should consider putting him on hydrox. So we started that, and they were monitoring the spleen. Like Dr. Klaassen explained, when we started the hydroxyurea, there was those 2 weeks blood work. It's a lot. It's intense. It's you have to, more going more to the hospital, having those. It's still invasive on the body, and you'll see that my son, for example, I know that he was a little bit, he got a little bit even scared of the fact that he knows that we have to get to the hospital, having those blood work, but just try to find a way around for them to understand that it is important. It is for you. You have to be there, and it's physical, emotional, and as a parent, you go through that with your kids, so you have to help with that as well. But we were the doctors and us eventually were happy with the result. There was no side effects whatsoever when he started that. We did not notice any diarrhea or whatever. But one thing that scared us, it's when we started it, they did not have the pill, or I think because he was too young, he couldn't take the pill. I don't remember the reason, but we had the liquid one that we had to pull. But when they give it to you, you have to wear gloves and make sure that. I was like, why I have to take all this, to be so cautious? Like, is this even secure for my kid? Like, it's raised a lot of questions. But once we started the pills, then it was easier for all of us, because it's always, you have to travel, you have to pack all those medicine. I remember, I don't know if that was with hydroxyurea, and I think it's hydroxyurea actually. We were traveling to Belgium. I think at the time it was still, no, we were going in the US. and we had our his medicine package, and at the border they asked us like to test it just for them to make sure that we're not carrying anything. We had the letter from Dr. Klaassen saying that we're allowed to travel with all that, but just to share a little bit of how all those can be. But when we started with the pills, and that just to share just a funny story with that. Even when we were in Amox, it was liquid. So he's growing up. Now we switched to pills, but he was unable to swallow pills. For us, for me personally, because I'm one of I know that even some adults has a hard time taking pills, but for me, it's just like I take the pill and it goes away. So I never thought that you need to be taught or teach to take a pill. So yeah, now you have to teach him how to take a pill. And he was like, and my husband has the great idea to buy the Tic Tacs, the Tic Tac. And that's what so we were like, take water, try the Tic Tac, because the Tic Tac, if you miss it, at least you can, it's easier like that. And that's how we started. And he was able, today he's taking it himself. We still have to remind him because, like Doctor said, it's an everyday thing. So we have a palette with the medicine, Monday, Tuesday, Friday. You can see if you missed a day because you see that definitely. You see that the Monday thing is. So when we started, they start and say, okay, let's go with one pill once a day. They do the blood work just to see the level. With Alicia, we're around the 20% of fetal hemoglobin. And I know that we started also talking about increasing. The first increase was one pill every day, then 2 pills on the weekends. Now we've switched it to 1 pill on the weekend and 2 pills every day. So, and every 3 months goes through blood work to see those numbers. If they're still good, fair enough. If we see that they're starting decreasing, that's where they will be staying, because it's going with your weight as well. So as it's growing, of course, they have to increase the dose and so yeah, that's what I can share. And for us also, just like Brittany, the spleen enlargement was really one of the biggest complication that he had. He had a splenectomy 2 years ago, and since then, thanks God, there's no, we have not been admitted since. Everything is going well. We're going to our regular check-in, and we still, yeah, he's keeping up with his life. I can say, because I have other kids that doesn't have sickle cell, so I can say that he almost have the same life that his siblings, and that's something as a parent definitely that I don't even know what word to use, but we are happy about that. And also I think, Brittany, you were saying there's the physical part or the psychological part. So it's a combination of all that will help you going through that. For us personally, we're Christian, so our faith helps a lot as well, and he himself understands that as well. And I remember at a certain point when he has to go through the splenectomy, and he was like, okay, I'll be hospitalized, I'll have a surgery, then then what will happen? And he was like, I believe God will help me through that. And you see that it's something that not only us, but we've been able to pass on him, and it's taking him, it's also helping him himself. So yeah, and the community is around. Like I said, I joined SCAGO 2 years ago, thanks to Chio. I heard about SCAGO through Chio, and that's another place where you're learning, like I would say I learn on a daily basis there, because blood, like you saw Dr. Klaassen show, like even knowing that there's 7 things around one thing that form a stick, and it's a word in itself. Sickle cell, it's a word in itself. There's SC, there's SS, there's AS, there's thalassemia. You learn all that, and yeah, it's just I don't know, I want to say it's wonderful, but yeah, that's what I can share on my side.